Hello everyone, hope you are doing great. In this week, our discussion topic is evaluating science-based claims, how to be health informed. This is a very important topic because when we explore social media platforms or any news sites, then if we face any mis and disinformation is encounter our knowledge. But when we face any health related mis and disinformation, it is basically so much concerned about our health issues, our safety, our public physical condition. So it's very important. So when we explore any types of health related content, any concept, then initially we can't believe it. We can't share with our peer, with our parents, with our relatives without any strong evidence. I experienced these horrible situations multiple times that without evidence, scientific any statistics or any authentic source, if any health related mis and disinformation spread, people used to be panicked and initially shared it with their friend, with their colleagues, and they actually shared panic situations among the people. I basically faced is during COVID-19 situations. In this time, about vaccination, about the social safety process, social distance procedure, lot of mis and disinformation spread, and people initially spread via messengers, inbox, or their timeline with their friends, peers, and in this way, lot of vaccine related misconceptions spread all over the world. So what actually learning from this side? We can't share without any strong evidence which is health related mis and disinformation because it's actually related with our health issues. And what types of things we have to consider as this information true or not? First of all, about the source. When we notice that this World Health Organization or any non-profit organizations or any particular office or websites who are working with particular disease, they are not saying anything about this concept. There are no evidence at who organizations are talking about this, then we should not believe this concept because always they are working with that, they have scientific data, and we have to believe these health related organizations, their scientific methods were evidence. And secondly, we have to focus that journal, is it peer evaluated journal or any personal blog? If any health related information spread via any types of personal blogs, we should not believe it. We notice that a lot of people, even though they have no any physician experience, they are not doctor, but they are sharing lot of information without evidence, like drinking lemon water can remove cancer. So we should not believe it. Not like that. Some gymnasium organization also, they are focusing on information like if you eat, if you drink this lemon tea, green tea, if you drink our products, then you can be fit. That will work for you, even though there are no scientific or any ingredients proof for that it actually work. So always as it's related with health, we have to focus on this journal. Is it real or not? Is it peer evaluated or not? And thirdly, we have to focus on real life examples. Sometimes people, as even though they have previously health condition is not good, but in the meantime they are taking any proper solid medication, and they are talking about it like that, okay, these symptoms for that medication, even though that's not true. So this real life experience examples also can be not accurate. So we always have to trust just only authentic source, the strong evidence. Recently in Bangladesh's people, I mean the child are facing harm crisis, harm issues. So this harm vaccine in our country, most of the times children used to take in their 10 months duration. But when people notice that this harm actually not affected people more. They used to not take this vaccine for their children, and now a lot of children are dying in my country for harm affection. So it's actually happened because people think, people assume, people notice an information that okay, as my child is not affecting by this, even though he or she not take vaccine, so your child will be also saved by you by this way. But that's not actually the proper medication information. So vaccines and vaccine related lot of misconceptions in our country and all over the world are existing. So if we face any types of mis and disinformation, we always have to focus on health organization related data, scientific data, and have to trust them. Another thing I would like to say that a health related mis and disinformations, it's a very important parts, and we always have to concern. Like cancer is a very effective disease, and when people affected by this, I mean it's very risky for our life. In my country, there have a page who have a multiple ingredients they are using in a herbal way for cancer treatment, and people without any strong evidence they used to buy their products like cortisol leaf as a herbal medicare systems, and they shared with their friends, influence other cancer patients to buy it, to eat it, even though there have no benefits from this cortisol. Just for their business purpose they are selling it and telling it that if any cancer patient eat cortisol leaves they will recover, but it's not happen. So after seeing this page authenticity, after observing the people's trust on this page, I was just wondering that this health myths and disinformation how affected us so horrible way. So as a student of media and information literacy, it's our core responsibility always focus on information, solid evidence, source, journals, is it true or not, not any types of people who are not a medical expert if saying anything without any justify any proof, we should not believe them. It's totally about our life risk, so we always try to be concerned about health related mis and disinformation. So as it's our last discussion topic, I would like to wishes you all the best, and always try to focus on the media literacy topic, which actually you are reading, is it true or not, and how actually you exploring environment, health, sensitive, rapist, or any political lot of topics, and how actually it's influenced the particular audience, what types of intention and assumptions they want to spread. So critical thinking level you have to explore more to understand the content meaning, to understand the media literacy properly. Thank you so much and best wishes for you, and hopefully you this course will be so helpful for you to understand the media literacy, and I wish you all the best.